So just to summarize this again, the two bispecific antibodies, much more similarities than differences. As I mentioned before, and I guess I didn't clarify, epcoritamab is an indefinite treatment where glofitamab is a finite treatment, meaning patients only get 12 cycles. So it's about 8.3 months of treatment, then that treatment stops. We don't know which one is best. Time will sort of tell us that answer that question for us. But that is really the only difference between the two drugs, other than the date when CRS is most likely to occur. I expect the initial outcomes with these treatments to be worse, just because I think the patients who will get bispecific antibodies now are much worse in the sense of their cancers are probably much more progressive. They have much more comorbidities than the patients that we saw in the initial clinical trials, because clinical trial patients are really ideal patients because they have to meet preset specified parameters, which most patients do not. Again, so no washout. So patients will likely have a lot of complications from prior treatments. And most of the patients who will get bispecifics today will be post-CAR T patients. And I think with time and community usage, we'll get a better idea of how these drugs will truly function in our patients. So I would think in the next 1 to 2 years, we'll get a better sense of how effective bispecific antibodies are in patients with relapsed refractory large cell lymphoma.